Hi, Susan. Welcome.
Hey, Dr. Flay. Merry Christmas. Happy holidays.
Happy. Yeah, it's great to see you. See Jonathan's on there. See Lori. Well, it's a minute or so after the hour. Maybe we should kick things off. Does that sound all right?
Sounds great.
We'll disagreeing, but well, listen, I have to make some opening comments. I'd just like to say it's great to have everybody here. We've got a good showing for our event today. I'm Tom Flagg, Vice Chancellor for Research. Wanted to welcome you. I'm just going to make a few comments at the top and then hand things over to Lori. I think it's great to have this opportunity to learn some more about the DOD and CDMRP specifically. Some of you might unfortunately have had to watch me speak yesterday at noon, so 2 lunches in a row, but we talked a bit about federal funding. We continue to be, as a campus, really competitive for federal funding. We had $370 million of federal funds come in last year. 2% of that was DOD. 87% of that was NIH. Now, again, some of that's natural with the nature of our research and everything else, but we do believe, the big we, that there's some opportunity in DOD, in CDMRP, and so forth. So some of the goals of today are through this seminar to understand some of the best practices around DOD. I would say, I would add to that, I think just becoming familiar and comfortable. As I've heard people talk about DOD funding, they sometimes say, that's different, or it's too complicated, or I don't understand that, or something. So hopefully, if nothing else, we can sort of demystify some of this today. We'll talk about some of the best types of research that apply to DOD. And there's a lot of different mechanisms. So I would say, again, I come from a cancer research background. There's certainly a program there, but there's lots of other programs within that. And the last thing is how to collaborate more broadly with the DOD and everything. So I'd like to thank everybody that's joined us today. There's about 60 or 70 people on the call right now, which is great. I'd like to thank Brett, our VP for Federal Relations, for all of his help in this today. And then our 2 great representatives from Cornerstone. So with that, I'll hand things over to my great colleague, Lori.
Okay. Let me get my screen up. Okay. So yes, thanks, Tom. Just wanted to introduce our host today. So at CU, we're really privileged to have Susan Sweat and Jonathan Miller from Cornerstone Government Affairs to help guide us through the medical research programs within the Department of Defense. Susan Sweat serves as a principal and director at Cornerstone, where she guides many higher education, corporate, and nonprofit clients in defense, healthcare, and appropriations process. Before joining Cornerstone, Susan served as the legislative director for Senator Roger Wicker during his time on the House Defense Appropriations and Senate Armed Services Committees. Jonathan Miller is a principal at Cornerstone and is a defense health expert with more than a decade of experience managing diverse medical research and development programs and appropriations. And Jonathan joined Cornerstone after serving as the Chief of Staff and Director for Research and Development at the Defense Health Agency. And we welcome him here on this webinar to give us information about DoD grant programs. So welcome and thank you, both Susan and Jonathan.
Fantastic. Well, I will just get started and tell you a little bit, just for half a second, who we are, why we're sitting in front of you. We are a government relations firm. We're based out of Washington, D.C. And what we do is help connect our clients to the federal government. And that's all different agencies and at different levels. Sometimes that's with Congress. Sometimes that's with program managers and everything in between. We're bipartisan. We are a top 3 firm. So one of the largest. It's independent. We're not a law firm. This is just what we do for a living. And we also have offices around the country. We're one of the few firms in DC that does that. So we have an office there in Denver where we do government relations work with your Colorado government and your governor. We have clients that a lot of higher ed clients, about 15 to 20 higher education clients, and just dozens and dozens of others that run the gamut from big companies that you've heard of to little nonprofits. And so we really tailor our strategies for our clients. And on our team, our national security team is the largest that we have at Cornerstone. We do work across all the agencies, but national security is a special emphasis area for us. And we have retired Army, Navy, Air Force, and Coast Guard officers. We have folks that have worked in a civilian capacity within the Department of Defense, and folks like me who are married to Department of Defense folks, and have spent their career working in that space. So next slide. All right, so what are we going to talk about today? We are going to do a little bit of information sharing about the different kinds of agencies that exist in the Department of Defense, and then how to engage them, and then how we help you do that. So pretty easy agenda for us. Next slide. And the next one. Here we go into some research agencies. So the Department of Defense has a ton of research organizations, as you can see here, that are focused on basic to applied research. So they really run the gamut. Some of these agencies are joint. Joint simply means they're involving two or more of the services. The services are the Army, the Navy, and the Air Force. So if you're new to DOD, one of the things you're going to have to get used to is the way that the DOD talks about normal things and with different acronyms than you would use, and the way they talk about themselves, right? So if it is the services are right there on your screen, the Air Force, the Navy, and the Army, and then the joint agencies are those that that are at a higher level and kind of cross all three of those service areas. The other things that we will talk about are research funding. So we think of that as R&D in the civilian world. If you're within the DOD, you're going to call it RDTE, which stands for Research, Development, Test, and Evaluation. Or you're going to talk about S&T funding, which is basic research. It stands for Science and Technology. So put those little things in the back of your head for when my colleague Jonathan starts talking in a little bit. But you can see that R&D funding is, the DOD has the lion's share of R&D funding across the federal government. So that's why we're talking about DOD here. That's why Dr. Flay wanted us to come and present, because that's where the money is. There's plenty of R&D funding that exists in the federal government. And so we're gonna, in the Department of Defense specifically, so we're gonna talk about how to get to that. Next slide. All right, so S&T, that basic research funding is what we're interested in. If you are savvy, you might have heard of budget activity codes. 6.1, 6.2, 6.3 goes all the way up to 6.9. These are the ways that the DOD organizes what they're spending money on. So they're spending money on research and development, that's great. But because that budget is so large, they subdivide it out. And so the S&T, or the basic research, is in 6.1 to 6.3. So we say 6.1 to 6.3 dollars. And that's primarily where you're going to be focused, right? That's about 20% of the DOD's R&D funding, RDTE funding, is in that S&T space that you might be interested in. And that's where universities generally get a lot of their funding from. It's in the S&T. There is the other part of the DOD's research budget, and that is for things that are at a higher TRL. So if you've heard of a technology readiness level, that's when we explain how far in the process of idea to full-scale deployment a technology might be. So if you're at a higher TRL, it means you've got prototypes, you're fielding things and working them out, or you're maybe revising and improving on an existing technology that is out in the field. We're going to talk today a little bit about all of that, but since universities tend to work in that 6.1, 6.2, 6.3 space, we'll probably spend most of our time in S&T. So next slide. Well, let's see. So there we go. That's my little spiel about basic research and that 6.1 through 6.3. You can see that the point of this slide is to show you how much basic research funding there actually is out there in the DOD. So a substantial dollar amount. We're talking, almost $3 billion. And the number that's there in the side, in parentheses, is the amount that Congress puts in on top of what the department asks for. So the department asks for a shade over $2 billion last year, and they walked away with $2.76 billion when Congress was done setting their budget, right? And that's because Congress found a lot of areas where they wanted to do more work. And it's not just that Congress wants to do more work, it's that their constituents do, right? So that's where you see a lot of universities and a lot of industry coming to Congress and saying, well, but we want to try this too. And Congress adds money for that research. So that's why we just specify that, because when we get to the end of our talk, one of the things that we're going to do is make sure that you're connected with your government relations office, and we'll start thinking about how we bucket out where we go to money. And sometimes Congress is one of the places where we might go to get some money for some research that we're doing. Next slide, please. All right, so DOD sets these broad priorities for research. And those are, you'll see biotechnology makes it on the top of this list for basic science and the interest areas that the Undersecretary for Research and Engineering, but our Undersecretary for Research has set. There's 14 areas that they've outlined earlier this year that are places where the DOD wants to put their investment. And they do that across basic research and applied research. And then they think about some things that they know that the commercial sector or that other government agencies are not going to be working on. And so they, when they're looking at biotechnology, for example, we know that the NIH and NSF and other groups across, private funders are out there putting a lot of money into biotech, right? A lot of industry as well. So the DOD understands that their piece of biotechnology isn't all of biotechnology research that happens in America. On the other hand, in a few slides, you'll see it, hypersonics, and it is a place where there is not a commercial market. There aren't other government funders. And so they own the hypersonic space almost completely. There's some industry partners, but hypersonics is an area that's specific to the Department of Defense and doesn't have other agencies involved in it. So they've come together and figured out 4 different basic science research areas that they want to focus on. And some of these might touch in areas that you're interested in. Biotechnology, quantum science, and you can see here advanced materials and some wireless tech. But biotech is what we're primarily going to be interested in now. Next slide, please. So that basic science is the S&T, is the idea, right, is in the lab. Applied research is when we start getting into prototyping a bit. And you can see that we're really heavy on data and what we think of as traditional, technologies, electronics and cyber work, AI, and computing. Those are the fields that the DoD wants to put the most applied research in. Human machine interfaces are a place where we might want to spend some time talking if you all have interest in that area. And then the next slide are those interest areas that I mentioned that are very, very specific to the Department of Defense. Directed energy here is something that you might have heard of, the Havana syndrome. This is lasers hitting our State Department and other folks in Cuba and around the White House and causing some cognitive and neurological damage. So this is a place where there is a lot of focus and it's very specific to the Department of Defense, but it overlaps with some things that you may or may not be interested in as we think about how to prevent directed energy and the effects that directed energy have on our assets. And the most important asset that the Department of Defense have is its people, right? And Americans like us. So next slide. All right, I'm going to turn it over to my colleague, Jonathan Miller, to tell you a bit more about drilling down into the medical priorities for research.
Yeah, I may just interject for a second here, Susan. Thanks so much. I'm just saying the Q&A. Just remind me, do you want people to use the chat function, or are we just going to open that up at the end?
Absolutely. We're happy to we can talk and chew gum at the same time. So if you want to throw a question in the chat, go for it. If you want to, at the end, we'll show you how to get in touch with us and dig in deep. If your question is very parochial and your one issue, we're probably not going to get to that in this setting, but we are happy to have one-on-ones and talk with you a bit more afterwards. But as you have questions, feel free to throw them in the chat.
Yeah, thanks, Susan. So as Susan mentioned, I mean, she was primarily focused on some of the more basic research that's outside of the medical space, just to kind of give folks a flavor of what the department is interested in looking at. As we move towards, future strategic medical challenges, what we had done in the department in the roughly 2018, 2019 timeframe was really try to get an assessment of, what the future battlefield would look like and the strains that it would have on medical assets within the Department of Defense. And as a part of that, we looked at near peer competition with Russia and China, et cetera, and really kind of developed some strategic goals and objectives with the understanding that in future wartime operations, we would potentially lack air superiority, which would delay evacuation times. We would see casualty volumes similar to World War II, as opposed to what we would see in Iraq and Afghanistan. And then we really needed to focus more on prolonged care environments, point of injury care, pre-hospital care, et cetera. And what were the challenges and capability gaps that we would see in the medical research and development activities that would need to be addressed. So what I wanted to do as part of this talk, I know we're going to focus on the congressionally directed medical research programs, but I did want to distinguish between what we would typically get as part of the president's budget, as part of what the DOD asks for as its quote unquote core programs, which is about $500 million per year. And the differences that has with the congressionally directed medical research programs. Next slide, please. So these are the overarching DOD medical focus areas. And, when we were looking strategically in the department a few years ago, we really tried to bucket these as part of, what would be the future challenges in the battlefield. And, for example, so the three major buckets that we have right now are combat casualty care, military operational medicine, and military infectious diseases. And these are all resourced as part of the department's quote unquote core budget. As again, I mentioned about $500 million per year in RDT&E. I know Susan had mentioned research, development, test, and evaluation. So there's a number of areas, for example, neurotrauma, hemorrhage control. There's a sustainment of expeditionary skills and medical training. And really what we've been working with the university at this point in time has been focused on the great work that Dr. Vic Babarda and the Center for Combat Research is doing, and really trying to build them into national leaders and embed them with folks in the Department of Defense in areas such as prolonged care, trauma overall, and route care, and in radiation-based countermeasures as you look to combined injuries. When we look at the military operational medicine space, that kind of focuses a lot more on some pre-deployment. So we focus on training injuries, musculoskeletal injuries, also psychological health, and just overall military health and readiness, specifically with performance in extreme environments. How do you optimize human potential, whether that be through sleep, physical fitness, nutrition, et cetera. And then for infectious diseases, I think everybody is really well aware of what we had to do in the department in 2020 and beyond associated with COVID-19 and emerging infectious diseases. So the department still is looking at viral and emerging infectious diseases in areas where the military may be engaged in future conflicts, as well as just kind of in operational scenarios that they're in Europe and in the Indo-Pacific. We also have a major focus in the department on wound healing, wound care and prevention, and technologies to support extremity trauma and ensure that folks don't get infections and sepsis, et cetera, in the event that they are injured. Next slide. So that was what's classically termed in the department the president's budget or core budget that we would plan out over the course of 5 years. Here, what I want to highlight, and I know this is kind of the crux of the talk today, is probably what I would say is one of the largest funders in the Department of Defense, if not the largest funder in the Department of Defense for medical, and that is through the congressionally directed medical research programs. This program was stood up 30 years ago through a breast cancer research program ad by Congress. and right now stands about almost $20 billion in federal resources that have been executed through these programs. It has grown substantially even since my time in the department. I had started in 2009 actually working for CDMRP, and the budget has, I would say, nearly tripled since the time that I started in 2009. There's a diversity of programs, which we'll highlight on the next slide, but really the focus here is on cancer-based research programs, programs associated with neurological diseases, and then sort of what we would term onesies and twosies, other areas of congressional interest that are put in by Congress for the Department of Defense to execute. Next slide. So as I mentioned, there's, I don't want to misquote, I want to say there's about 33, but I haven't counted since last night, so I may be off. But these are just highlighting the fiscal year 2022 programs that are executed through the congressionally directed medical research programs. As you can see, here's a wide variety in terms of investment positions from 4 million all the way up to 370 million. What I do want to highlight here, though, is, note that there's 33, 35 programs, but embedded in those programs are about 80 different topic areas. So for example, in peer-reviewed medical, that used to be a $50 million program when I started in the department. It is a $370 million program as of fiscal year 2022. That covers about 50 different topic areas focused on a wide variety of disease states and injury patterns. So it could be cardiovascular health, diabetes. We've seen items added for emerging infectious and viral diseases. In fact, that's how we actually supported some COVID-based research in the department in 2020. There's focus areas in respiratory health, food allergies, etc. And then I also want to highlight there are cancer-based programs. As you can see, there's breast, prostate, lung, ovarian, etc. But there's also peer-reviewed cancer. And as part of that, you may not see research or specific research activity with funding for brain cancer. Well, that's because it's embedded in peer-reviewed cancer. Same thing with bladder, same thing with pediatric tumors, etc. So just want to kind of give folks an overview and highlight just the robustness of the programs that are executed through CDMRP, and also highlight here opportunities to contribute to the CDMRP programs, whether it be serving as a peer reviewer, so that way you kind of get embedded and learn not just how the system operates, but learn about what types of proposals are successful coming out by volunteering and becoming a peer reviewer, or a programmatic reviewer. So we'll go through the CDMRP's two-tier stage review process, but we've had folks from Colorado, for example, Dr. Babarda from the Center for Combat Research, has served as the chair for the Combat Readiness Medical Research Programs. It's a great way to really help within the DoD and kind of further understand these programs. Next slide. So here I just want to highlight, there are obvious differences between the DoD program cycle related to CDMRP and the traditional National Institutes of Health cycle. So I just want to give a very brief overview, and obviously happy to go into more detail if folks would like. So really, when we engage with a new program, it all starts with a congressional appropriation, which has specific congressional intent about what research should be conducted. So what CDMRP will do, they'll engage a variety of stakeholders and experts in that specific disease state or injury pattern, and they'll create a stakeholders meeting. From that stakeholders meeting, they'll kind of do an overview of the state of the science, what specific areas should be drilled down into, whether it be in breast cancer or psychological health, traumatic brain injury, and then they'll host a vision setting meeting. So I don't want to underscore the importance of the vision setting meeting, because that happens every year, whether it's a new program or an existing program. And that's where leaders in the field, specifically on the programmatic panel that CDMRP creates, distill down what focus areas they want to go after that year, say, for example, in traumatic brain injury. And then from there, they actually create language for the funding opportunities that they want to go after. That language will include the focus areas. That language will include the award mechanisms they want to use, whether it be a clinical trial, a concept award, investigator initiated, et cetera. That meeting will allocate resources to each specific award mechanism they want to go after, as well as period of performance, peer review criteria, and any additional programmatic review criteria that are going to be requested from those funding mechanisms. From there, funding opportunities are released, and then what folks will be asked to do is to submit a pre-application or a letter of intent. They're a little bit different, and we can go into the nuances, but a letter of intent is simply just an administrative activity. So folks within the government have an understanding of how many potential applications may come in, whereas pre-proposals or pre-applications are actually reviewed by a screening committee. From there, folks will be invited to submit a full application, and then following application receipt, there is a two-tier review process. One is a peer review that evaluates against criteria that are mapped into the program announcements or funding opportunities. And then second to that, following peer review, they will go through a programmatic review where folks look for kind of various criteria, but it's typically based off of military relevance, adherence to the intent of the award mechanism, overall programmatic balance of the program. So for example, making sure that we don't have 50 projects focused in one area and 0 in another. And then from there, funding recommendations are made, and then folks are notified and awards are negotiated. The typical program life cycle for this activity is anywhere from 12 to 18 months from conception and release of a program announcement to award. And then the typical period of performance varies. We've seen period of performances from 12 months all the way up to 48 months, depending on if it's a clinical trial. Next slide. Here just distills down, I'm not going to go through this, but just distills down a little bit deeper into the application process. As we mentioned, letters of intent, pre-proposal, full proposal, etc. But we can highlight this later and get in more depth if folks need. Next slide. So here are just some of the funding opportunities and award mechanisms. The DoD has a pretty robust program on the medical side. It ranges from $60 to $80 million per year for SBIR and STTR, the Small Business Innovation Research Programs. There's also an annual, it's a broad agency announcement that is open all year round, so folks can submit to that at any time, and that covers a wide variety of areas within the President's budget or core programs that I had mentioned. There are program announcements; those are issued through CDMRP and are specific to the various congressional programs. Sometimes folks will use CDMRP to execute the core programs as well. So you may see one come out, for example, for combat casualty care or for military infectious diseases. Then from there, from the solicitation cycle, there are various award mechanisms that the DoD can use. I am a large proponent for other transaction agreements. Those are a unique mechanism. Susan is laughing because I was part of creating the DoD consortium for medical for using another transaction agreement. That's a 600-member organization that the CU team are members of and can access. But they give a lot of flexibility to engage one-to-one with program managers and leaders in the government to help shape statements of work and ensure that the department is getting the work done that needed to be done to address capability gaps. Classically, the department has used through CDMRP grants, which could stem anywhere again from 18 months to 48 months. Cooperative agreements are another mechanism the department uses to allow more government engagement. Contracts guided by the Federal Acquisition Regulation. And then another mechanism that we like to use during my time in the department, and that we currently the DoD still uses, are cooperative research and development agreements. And those are ways for folks within the university system to really work hand in glove with the department's intramural laboratories and investigators to solve DoD problems. Next slide. Here again are just kind of some more funding opportunities. I mentioned the medical consortium that the CU system is part of. That's the Medical Technology Enterprise Consortium. They will release solicitations, kind of as they come up. There's no real definitive timeline. It's really dependent upon budget cycles and program interest. There's also one for Chem Bio Defense. Various grant programs. I do want to highlight for the Defense University Research Instrumentation Program, and that enables universities to get awards to purchase equipment to support their laboratories. It is a competitive program, but really what you have to do is just demonstrate how the purchase of the equipment through the application would be beneficial to the DoD and the DoD needs. There's also UARCs and FFRDCs. Those are federally funded research and development centers and university affiliated research centers. It's just a mechanism for the DoD to really kind of send money and execute research faster. Next slide. So some tips and strategies for success. I won't read these off, but the first thing that I would say is relevance. So you want to ensure that the work that you are putting forward addresses the actual requirements set forth in the program announcement. You know, I don't want to be glib, but don't apply for cardiac health when the focus is on cancer, for example, or cardiac health if they're looking at traumatic brain injury. You want to make sure you address what the scope is in the actual funding announcement. Innovation is also usually a big portion of what happens within the CDMRP programs, as well as impact. What's the general and overall impact that it's going to have? They don't necessarily look for kind of just incremental steps or iterative solutions. They really want to make a splash in supporting warfighter health and readiness. Feasibility is a major key. And I say this as someone that's been in the department, and these tips and strategies for success are really emulated as part of the solicitation process. We had to go through many iterations to ensure that studies are adequately powered and that you have statistical support so that you can understand the data that's coming through and address any future unforeseen research questions. I'll highlight the importance, the real importance of availability and access to resources. This isn't just reagents, this is patient populations. We've had a number of studies that didn't come to fruition and millions invested that didn't lend itself to a result because of lack of access to DoD-based patient populations or just patient populations in general for clinical trials and clinical research. And we've also had a number of studies go on clinical hold through the FDA. So we want to make sure that you have access to the right resources you need for the research to be successful. Next slide. Planning and timelines. So where we've been burned in the past is for folks not adequately planning for submissions through IRBs or through human subject research protection offices, as well as through IND, IDE submissions through the FDA. So I can't underscore enough the importance of having actual plans that the DoD can review to ensure that the timelines sync up with the funding that's going to be allocated, and just to ensure success of the award. Multi-organizational efforts ensure that you put forward a clear plan for coordination. Most of the mechanisms that come through DoD allow for partnering principal investigators, sometimes up to 4 different organizations to participate. And I would really want to highlight the rules for collaborations with military laboratories. You know, understanding what the budgetary items and asks are from the military labs. We've had a number of investigators that have put in proposals with military laboratories as co-investigators and don't account for their budgets, and that leads to major problems in the department. Of course, grantsmanship, clarity is key, but one thing that I will say is be compliant with the timelines. I have never seen someone get a thumbs up to extend a timeline because they were late in submitting through the portal or through the website or what have you. And there is no congressional action, no letter that's going to change folks' mind in terms of the contracting activities. You have to be compliant because they see it as an unfair advantage if you're given an extra minute, let alone an extra day. Next slide. All right, with that, I'll turn it on over to Susan.
Sure thing. So, all right, we've just listed out a whole bunch of different agencies, a whole bunch of different programs. We've told you about portals. Great. What does all this really mean? The DoD operates differently than NIH and NSF, if you're familiar with those two agencies and how they do their funding, right? So with NIH, you're going to have a great idea and submit it, and you're going to get a peer review score, and the NIH program manager puts together the list and just funds down the slate. They start with the top peer review score, and they keep funding till they run out of money. And that was how you got your funding. The DoD starts with a problem that they need a solution for, and then they socialize that problem with academia and researchers across the country in search of solutions, and then invite those solutions. So there's 3 real tracks when we think about DoD funding. I kind of like to divide it up into 3 different buckets. There is the bucket that Jonathan spoke about right after I handed the mic to him, when he talked about combat casualty care and operational medicine, when he was discussing the need to evacuate people from the battlefield, the war fighters having blast injuries or endemic infectious disease in a different part of the world where we might be fighting. Those types of things are true military relevant R&D efforts. They are funded to the tune of about $500 million a year, and they're funded by program managers across all of those agencies. If you think back to one of those first slides where we had the joint list of agencies in the Air Force and the Navy and the Army, so that those agencies are executing that $500 million of medical research funding, and most of those agencies, with the exception of one or two, are also executing research and development from other areas like tech. And if you the main agencies I'm thinking of here for you to be thinking about are the Air Force Office of Science and the Office of Naval Research and the Army Research Office, DARPA, which is advanced about, way out there in the future, 30 years from now, cool, wow stuff. And DITRA, which is interested in chem bio, prevention of chem bio effects on our warfighters. Most of those agencies aren't just medical. In fact, the Defense Health Agency is the only one that's just medical. Everybody else has R&D money coming in for other things, but they all operate the same way. They have program managers that have a great bit of latitude. And let's go to the next slide. They have a great bit of a lot of latitude for how they engage with academics and with researchers. And so some of those program managers are not even required to solicit for peer review scores. They might not even be required to issue a funding announcement. Many of them do. DARPA is a great example that I like to give. If you are applying to DARPA, when you see the funding announcement, you've missed 80% of the competition already, because DARPA, like many of the other DoD agencies, it's all about socializing your research ahead of time. So you want to look for opportunities to engage with program managers about the work that you're doing and seeing if that is of interest to them, if this is a space where there might be a great collaboration. One of the easiest ways to get to success with DoD funding is to collaborate with another DoD lab or entity doing that research. And so looking for ways to collaborate with DoD entities and then socializing and engaging with funding decision makers before you ever apply and before they ever issue an announcement is the keys to the kingdom for that $500 million of military relevant research that we talked about. Now there's another bucket of research. And so if we think about that, that $500 million of military relevant stuff for your purposes on campus, like that's a lot of the stuff we're doing with the Combat Center, right? Y'all might know Vic Bavarda and his group, and Jonathan mentioned them. They are engaging in that bucket. And I think of that bucket as like socialization plus competition. And I see a question popping up in the chat. How do we find these program managers? You're jumping ahead because that's what we're here for, is to help you. Now, in your case, the infectious disease program manager is a guy named Colonel Stu Tyner, and we can help you engage with him. But I think of that bucket as socialization plus a maybe competition. Then we have CDMRP, the Congressionally Directed Medical Research Programs, and Jonathan went through those 40, he says 33, I say there's 40 and we left some off the slide, we'll see. Jonathan went through those with you, and those I kind of characterize as more like informed competition, right? So a lot of your programmatic reviewers, remember Jonathan talked about the 2-tier review process. Looks a lot like NIH when it's the first tier, but when you add that second tier of programmatic review, it looks more like the DoD and that straight up socialization. So I think of that as kind of an informed competition. You want to know who's in that programmatic review. You want them to know of you and of your work because it helps increase your chances of funding. You're not just reliant on a really good peer review score. Because remember, those programmatic reviewers, you could have the best peer review score, but if they've funded that for the last 5 years and are tired of it, they won't fund it again. And you could, you could also have be looking at a molecule that 3 other people are getting funded at through that same program, and they'll skip over you because they want to move to a different molecule and move on from that area. So it's important to have that socialization with those programmatic reviewers in order to compete well. So I think of CDMRP as our kind of informed competition. There's another bucket, we won't get into that as much. That's a way that we can do congressional funding for your research. Quite frankly, Colorado doesn't have a very robust congressional delegation when we think about the committees that they sit on and that enable us to do that. So I don't want to give false hope and spend a lot of time talking about how we do things called programmatic increases, where Congress dumps money onto the lap of a program manager who you've already been working with and likes you and will fund you when they get the money added. We don't really want to give you false hope and think that's going to work. But those are our 3 major buckets. And socialization, this slide is the key to all of those, right? It plays a larger outsized role in that $500 million, but it is still very important for that $1.5 billion in CDMRP programs that come up. And there's a lot of ways to socialize. That's picking up the phone is an antiquated approach that actually works. So talking on the phone with program managers, meeting them organically through shared connections, going to conferences. Jonathan and I were with a huge team from Anschutz back in September in Florida, where you were at the big military health research symposium, MHSRS. It's the DOD's big healthcare conference. But there's other conferences where you'll find DOD program managers, and having the people skills and being bold enough to just go up and introduce yourself and strike up a conversation is really important when we think about DOD. Next slide, please. Jonathan mentioned this, I won't harp on it too much. Military relevance is also really important. Don't come up talking to a program manager in that first bucket about how great this is going to be for the civilian population with diabetes. Not of interest to the DOD, right? Maybe of interest in a CDMRP program, but tying it back to the military population or the veterans population will increase your chances with CDMRP. And might get you at least a light listen in that first bucket, right? So thinking about things the way that they think about things. DOD, especially in the first bucket, not interested in your idea, interested in your solution to solving their problem, and not just science for science's sake. Even with congressionally directed medical research, it's usually more applied. It's usually thinking, even if it's basic science, it's conveying an understanding of how to solve a practical problem that this patient population experiences. And then being aware of the operational environment that you will, that your technology could eventually be used in. So if we're in that first bucket, very military relevant, if you've got a new widget, but that widget weighs 10 pounds and requires 3 pounds of add-ons, and you're proposing to put it in a medics bag, we don't even have a conversation. There's you're so far outside of the orbit of what the DOD is operationally constrained by, that's not a productive conversation for us. So we really need to think about what their constraints are. And a lot of times that's austere environments that are low resourced, and they're really, thinking about how to make things platform technologies that work across a range of different injuries, that work across a range of different body types, and are as small, as lightweight, and as possible without using much power. Next slide. We kind of went through this. Science for science's sake is not what they're into. And we'll leave this as, you'll get these slides and you can kind of read through this a little bit more. But having that engagement with the program managers is the biggest tip for success. Knowing your audience and engaging in that audience is the way to really find success with funding. Next slide. So now we told you, you have got to go engage with them. So that can be daunting. And how do you find out who they are that you're supposed to be engaging with? Well, that's what we're here for. So we are here to help point you in the right direction. If you're thinking about a CDMRP application, which one is right for me? How does this work? Some of the CDMRP programs rely on much more socialization with the military than others do. So like a breast cancer or prostate cancer program. I mean, we're going to do a separate cancer focused webinar, not as much military engagement as you might see in an orthopedic research program where there would be a high level of engagement that would be helpful with DOD program managers. We can help you identify those program managers. We can tell you if your idea is going to be within the, kind of within a fundable interest area. We can point you to the interest area, the program manager, and help you kind of develop a strategy for how you might want to pursue DOD funding. And we really just help you build those relationships, right? Whether that's setting up phone calls, joining you for phone calls, introducing you at conferences. And then we can even review some of your proposals just to make sure you're not completely missing the mark on that military relevance. We're not proposal reviewers, but we definitely can help advise and answer some broad questions and give you some technical advice on those. So that's what we're here for, and that's what we've been engaged to do is to help you with that. So next slide, please. I think we're gonna take your questions, and I know there's been some in the chat, but we're happy to let folks go off mute and ask us some questions if they just turn on their camera, say their name. One of the important things for you to know is that that you have a team at CU that is there to help you. So Brett and Laura are there in your well, I guess Brett's not on campus. He's out here in DC with us, but they're there physically housed in CU facilities and ready to help connect you to us. So they're kind of your first line. They're going to be the funnel for all the fun questions and hopefully interest that we get out of this webinar and can help connect us. But we'd love to take your questions now if you have any.
Hey, it's Laura. Thank you so much, Jonathan and Susan. I have a few questions that have come in through the registration. And of course, if anyone on this webinar has questions, feel free to put it in the chat or raise your hand and you can have the floor as well. But so a few that came in were, is aging research encouraged? Can you talk much about aging research?
Yeah, sure. I'm happy to take this one. Yes, it is. So as you can see, there's a variety of programs, for example, Alzheimer's research. But yes, the research in aging is absolutely of importance to the department, trying to understand the mechanisms associated with that. And in fact, we are actually in discussions now about the potential implications of military-based training and its impact on the aging process as well. So, yeah, I would certainly love to hear some ideas of what folks are thinking related to aging.
Great, thank you. So, just to follow up on some, Susan, do you have one you want to talk about?
Well, there's one that just came in the chat, if that's okay, Laura.
Go ahead,
about veterans and VA funding, and thank you so much for bringing that up. So, the VA, as you probably well know, you have a VA there in Denver that you likely collaborate with, has their own source of research funding. And of course, to access that, you have to be a 3/5 employee. So you have to have a shared appointment with the VA and your campus. But but they have their own funding and they do a lot of research that's very specific to veterans. If we talk in broad strokes, and there's always exceptions to this, the DOD is more interested outside of those CDMRP programs. When we talk about their core budget, that $500 million, they are generally more interested in things that affect the active duty population, which generally is, you know, men under the age of 40, right? Is what you get a lot of stuff on. Now they're getting very excited because we've got more women joining the force, and there's a whole new level of research that they have to do now that we have more women coming into the force. And we're also thinking about going to different areas, which causes you know, different demographics to have more interest, different interest areas. But when we think about DOD with very broad strokes, they're really interested in that active duty force, and the veterans or the VA tends to take the lead on those things that affect vets. A few places where we see something different would be in the prosthetics space, right? Prosthetics and when we think about recovery from these most recent injuries that we've seen in Iraq and Afghanistan with blast injuries, when we think about PTSD and some traumatic brain injury, and then toxic exposures. Those are all places where a veterans population is very much of interest. But if we're thinking about things that are not specific to a DOD injury and just happen to occur in the veterans population, that's going to be the purview of the VA for the most part.
Okay, I'm going to follow up from that and talk a little bit about, or ask questions about eligibility. So there's two specific that came through. Can you talk about whether multi-PI applications are, you can go in as a multi-PI, I should say, are they supported? And are there opportunities for postdocs or mentored early career investigators?
Yeah, so I can take this. So it's contingent on the award mechanism that comes out. So for example, in the breast cancer space, there may be 6 to 7 different funding opportunities that come out within any one given fiscal year. For most mechanisms, partnering PI, multi-PI collaborations are encouraged. And then for some programs, they actually offer pre or postdoctoral awards. And we've seen a variety of programs that offer on an annual basis new investigator awards. So all the eligibility criteria for specific mechanisms is called out in the actual program announcement. So for example, new investigator could be at the, you know, just recently left the postdoc within 3 years, now at an assistant professor level. So has not received more than $1 million or $500,000 in DOD funding within the past year or so. So everything is really contingent on the award mechanism and program, but it's all explicitly spelled out in the funding announcement.
And can I just piggyback on that and say that one of the other things that we didn't mention that we probably should have is that a lot of the service specific agencies, so the Army, the Air Force, and the Navy, they're research agencies, which are not DHA, not the health research agency, but they have young investigator programs that could be of interest as well. So we talked about DURA, the instrumentation program. There is a MURI program, which is a multidisciplinary program, and then a young investigator program. And all three of those programs go to the Army, the Air Force, and the Navy's Office of Science or Research Lab that doles out the funding to extramural investigators. And those three programs have different pots of money than the ones that the program managers normally have access to. So a lot of times when you're socializing with the program managers, and we can help you with this, sometimes thinking about those different pots of money, and the program manager decides who gets them, could be a great kind of backdoor way of not taking that program manager's money away from them if they have it you know, earmarked for other causes, but getting into relationship with them and getting funding. There's definitely some other mechanisms we can talk about.
I have one more question I want to bring up, but the first thing I wanted to say is you all may see that in the chat, there was a link to a form, and I just wanted to let you all know what exactly that is. There is an opportunity that's being provided through the Vice Chancellor's office to submit your ideas. If you think you have a research idea that aligns with the DoD, you can submit your information. It's very brief, who you are, what your idea is, and then that will be vetted. And those that feel like they align with the DoD, we will provide some funds for Jonathan and Susan at Cornerstone to work with those individual investigators. So there is this opportunity to take this. That's kind of the next step. So here's the information. And then hopefully we have some researchers that can actually work with this amazing group and submit some applications. The last question, or kind of just advice from you all that I thought you could share, if you could identify the top 2 or 3 common mistakes that you see in applications, what would those be?
So I'll say that when we see a researcher with a great idea who's trying to jam their round peg into square peg into a round hole, right? When we see you come up with a great thing that you want to research, but you're not paying attention to the feedback that you're getting from program managers about, well, yes, if you did this, that's just a big, often can be a big deal breaker. When you're not willing to be flexible enough to meet the DoD with where their problem is and how you can apply your work to their problem. Usually there's a place to meet in the middle, but it does require socialization, interpersonal communication, and flexibility. I don't know, Jonathan.
That's the key here. I've heard that. I think that's the take-home message.
Catching the theme, yeah.
I got it. Jonathan, did you have anything?
No, I think Susan nailed it. I mean, just being responsive, you know, is if your budget is not in line with what the award mechanisms call for, the focus area that it's calling for, then it's just not going to be, it's not going to fare well, both from a peer level or from a programmatic level. So yeah, those are kind of the major pitfalls that I would avoid.
So Laura, maybe in the interest of time, we should wrap things up. Would you like me to make some comments?
Yes, please.
Yeah. Well, boy, that was a very quick hour with all the information, and great to see the interaction too. So I'd just like to say thank you, Susan and Jonathan. Your expertise is clear, and I think your guidance through this opportunity is really important. So we look forward to your ongoing engagement. I'd like to specifically thank Brett. Brett's name is on the screen there, from the President's Office at the university. We've had great support of this program from the President's Office and Brett, and we really appreciate that. Laura Buccini has been great. Again, Laura's new to our leadership team, been a great addition, and I think they do a lot of great work here. I would just say the one thing I'm going to put out there as a question maybe to Susan, Jonathan, our group is, how can we as a campus best promote the myriad of different opportunities? We've got a couple of mechanisms through Research Bolt and things, but maybe your advice to me offline or whatever, us, on how best to do that and organize this would be something really useful. So lastly, I'd like to thank everybody that took time today. This has been recorded. It'll be available, but I think it's great. We've got a couple of different talks coming up, CDMRP, cancer, as well as Brett's, again, for the President's Office, be doing a legislative update with the research focus, what's been done, ARPA-H, other programmatic things. So with that, unless I'll do a last call if there's any other announcements from anybody. Otherwise, our great thanks. Thanks for joining us today.
Thanks, everybody.